The behavioral response unit is we're going to team together clinicians from Devereux that are going to work with deputy sheriffs. They're going to be responding to calls for service related to mental illness, PTSD, and some substance abuse cases.
A mental health clinician is in a better position to help people who are in crisis. Many times our deputies, even though they're trained in crisis intervention, they don't always have all the tools they need to help people who are in crisis.
Devereux has experience with mobile response services, and this was an awesome opportunity for us to expand our skill set and be able to pair with the Sheriff's Office to serve more individuals in the community, especially that adult population.
They will be proactively on patrol. They'll be listening to calls, they'll be looking at our calls for service. They'll be working with our veterans, they'll be working with our homeless community. If a call goes out, they'll start listening to the call and heading that way.
Our model is the co-responder model, which pairs a deputy sheriff with a clinician and they respond together.
We will let the deputies, the patrol deputies, get there first and see what's going on in the scene, and then have our behavioral response unit arrive on the scene and see how we can best help the person.
So the clinician and the deputy hopefully being able to combine their skills to engage this individual, find out what it is that they need from us, then be able to find out how can we further assist them, get them linked to ongoing services that can hopefully prevent any future crises.
Hi, my name's Delaney. I'm with the Behavioral Response.
Oh, yeah.
I'm here to make sure everything's going okay with you.
The last heartbeat.
We spent some time talking about what our role is, what the policy is, how we're going to work together. We also got to hear from the clinicians, where they got to teach us and talk a little bit about what they do and how they do it.
These clinicians are master's level, working towards their clinical license for the state of Florida, and this is what their passion is. This is what they like to do.
The community wants us to be more involved in providing better services with our mental health community. And what better way to do it with a clinician who's prepared, not only with their education, but with their experience on dealing with somebody who's in crisis.
It is a pilot program, and what I'm hoping to see is that we do respond out to some of these cases and the cases are de-escalated. And if it is successful, we want to expand the program and help our community even further.
I expect this is going to become a big part of the Orange County Sheriff's Office, and I also believe it's going to be a big part of law enforcement overall.